different the different um, the different perspectives that the standing committee gives you, the different opportunities, and the different um, platforms that SCOPH offers you. So yeah, I hope that you enjoy the session. If you have any questions at any point, if you have anything, just feel free to type it in the chat. I might not be able to respond right away, but definitely after I finish my presentation, I'll be very happy to receive and answer your questions. So yeah, IFMSA and SCOPH. First of all, I guess you already know a bit about IFMSA, but this is just a small reminder. IFMSA is a federation that gave us the medical students worldwide. It gave us around 1.3 medical students from around 133 countries. Um, and has been working since 1951 together with the United Nations, WHO, and a lot of other external partners. In IFMSA, we have 6 different standing committees that works in a lot of different areas, including public health. And yeah, the general vision that we have in IFMSA is a better and healthier world. Very simple, in a very simple way. So yeah, these are the 6 standing committees that we have. We have the Standing Committee on Medical Education, the Standing Committee on Professional Exchange, the Standing Committee on Public Health, yay, the Standing Committee on Sexual and Reproductive Health and Rights, including HIV and AIDS, and the Standing Committee on Research Exchange. And last but not least, we have the Standing Committee on Human Rights and Peace. But yeah, as I told you, this is just a small reminder, and we're going to talk specifically about the Standing Committee on Public Health. So generally, the Standing Committee on Public Health started since 1952, which means that it was one of the very first standing committees that was created in the Federation. The Federation was created in 1951, and after 1 year, they created a standing committee called the Standing Committee on Students' Health. At that time, they did not know that the Federation will grow bigger and will include more than 150 or 130 animals or national member organizations. They thought it would just focus on the students' health and the students' exchanges and all the stuff that are related to students. So yeah, the first version of SCOPH was the Standing Committee on Students' Health. But after around 11 years, they just figured out that it's not about the students only. It's also about the community and about their health. So they changed the name and the perspective of the standing committee from being focused on the students' health to focus on the health in general. And it became the Standing Committee on Health. Then, after 2 years, they also figured out that calling a standing committee the Standing Committee on Health is very general and it's not something specific. Whenever you want to achieve something, you need to be very specific and you need to know your goals, your objectives, and the thing that you want to achieve it by the end of the day. So they changed it to the Standing Committee on Public Health. And after that, they actually created the Standing Committee on Sexual and Reproductive Health and Rights. They also changed the name of the Standing Committee um, on Refugees to the Standing Committee on Human Rights and Peace, and they tried to divide the word health into different categories and different standing committees. So yeah, and one of them was the Standing Committee on Public Health, which basically works on the community health. So, what is the vision of the Standing Committee? Basically, the Standing Committee on Public Health um, wants to have wants to have medical students attain the optimal skills and knowledge to contribute to their full potential towards the making of healthier communities in their capacity as medical students and its future health providers. So, in other words, the way that or the thing that we want to achieve from having the standing committee and from having all the activities that we're currently doing is to build the capacity of our medical students on the different public health topics and make them able to contribute to their communities and also prepare them to be the future healthcare providers. That's why you will notice that all the activities that we do within the Federation and the Standing Committee aims to build the capacity and aims to teach the medical students in a way or another. Even if the target of that specific activity is not the medical students, even if it's the general public or other health students. At the end of the day, it benefits medical students in a different way. In example, if you are organizing community outreach or health education at the rural area, I'm sure that the general population will definitely get benefit, and they'll definitely know more information about the different health issues. But at the same time, the medical students that will perform the health education will also get some skills. They will be able to speak to the public, they will be able to know more information about the topic they are talking about, and they will also be able to train themselves on being the future healthcare professionals. So yeah, we definitely work for the community, but at the same time, our base is the medical students. What is our mission? As some of you might know, the vision is the thing that you want to achieve, whereas the mission is the way you achieve that. So the way we want to achieve our vision is through promoting the development of medical students worldwide regarding public health issues through an international through an international sharing, knowledge, network, project management, community-based learning, capacity building, advocacy, exchanges placements, and access to external learning opportunities. It's quite a lot of methodologies, I know. But yeah, we'll get to know each one of them through our presentation. So first of all, who runs the Orange Word? The SCOPH International team. This is the answer. I'm sure that it might look a bit weird that regular medical students are running such a federation. But yeah, this is the power of youth. These are individuals. This is not the whole team. This is just a small disclaimer. This is part of the team. But yeah, we have around 17 individuals working for the SCOPH International team this year. Each one of them has a different role, and each one of them focus on a different issue. But at the end of the day, their main task is to serve you, medical students, and to make sure that everything is prepared for you. Throughout my presentation, I'll let you know more about each one of them and the role that they play in managing the standing committee. But yeah, for now, I just want you to know that there are 17 individuals who run the standing committee. So what does SCOPH has to offer you? This is the most important question that I want you to know today. The first one is capacity building. As I told you, the main thing that we do is to build the capacity of medical students to make them prepared, to give them some skills and knowledge to be the future healthcare professionals. And yeah, for us as a standing committee, we have different workshops that we regularly do. They're not our only workshops, but they are the main ones. The first one and the most famous workshop that SCOPH does is the public health leadership training. This workshop has three main pillars: public health, leadership, and activity management. It basically teaches you how to be a better leader, how to lead a team, how to engage within a team, how to make an activity from A to Z, and how to also advocate for the different activities that you do, how to fundraise, and how to, yeah, basically everything about activity management and about doing activities. I highly recommend that you attend one if COVID allows us, definitely. Then the second workshop is called Mental Health Essentials for Future Healthcare Professionals. It basically focuses on mental health. I don't think there is anything else to say. Then we have a workshop called From Advocacy to Policymaking. Um, as I told you, we work on the internal level on a lot of activities. We have community-based activities, we have projects, we have programs, we have a lot of stuff that we do on the internal level, but also on the external level, we have a lot of collaborations and a lot of partnerships with different organizations such as WHO, the UN agencies, and a lot more. So we also work on orienting and building the capacity of our members on that field. We definitely send our members to different meetings and different conferences. But before that, we also need to make sure that they understand their thing and they can represent the federation in a good way. If you're interested in the external affairs, so from advocacy to policymaking is your workshop, because it would teach you how to um, talk to externals, how to make policies, and how to be a better advocate. The third workshop is called PHLT Trainers Online Course. It's a bit different from the PHLT or from the regular PHLT, as it teaches you how to deliver a PHLT. This might be a bit confusing, but yeah, basically the PHLT is the workshop, and the PHLT Trainers Online Course is the other workshop that teaches you how to deliver that one. So again, PHLT is a workshop that you attend in order to get the skills, the activity management, the public health, and the leadership, whereas the PHLTT is the workshop that teaches you how to deliver the PHLT workshop. I hope that was clear. Then the next workshop is the activity management online course. This is a 6 weeks online workshop. It purely focuses on activity management, starting from identifying your problem until making your report. It's very comprehensive and it's also very simple, and it's online. This is the most important thing. The PHLT Mental Health Essentials and A2P are in-person workshops. The PHLT is online, but it doesn't happen a lot, whereas the AMOC happens regularly. We had two activity management online courses last term, and hopefully this term we have around five. So stay tuned. Then the last workshop that we have is called the One Health workshop. It's basically about the concept of One Health and also the idea of creating activities and advocate for One Health. So yeah, these are the different workshops that we have in SCOPH. Then the next opportunity is called the public health exchanges. I'm not sure if you are familiar with the professional exchanges that IFMSA does, but generally the idea is that um, no, I'm sorry. It's just an exchange in the field of public health and primary healthcare in general. It's a collaboration between the Standing Committee on Professional Exchange and the Standing Committee on Public Health. And yeah, also the students from health science faculties are eligible to apply. The main idea is that you spend 4 to 8 weeks duration in another country, whether it's in another region or it's in your same region. It's fine because yeah, some people thinks that the professional exchanges need to be in another region, but yeah, this is not correct. It can be in any other country aside from your country, as definitely. The only requirement for the public health exchanges is that the other animal or the other country that you want to go to is SCOPH active. So I can't tell you a lot about this. I'm so sorry if I'm confusing you. But generally, what you need to know about the public health exchanges is that it's a 4 to 8 weeks duration exchange to another country. It would be on a public health topic, and you will work at one of the public health institutions, whether it's a governmental health department, whether it's an NGO, or even a hospital. The housing and boarding and even the social program will be arranged and covered by the hosting animal. There are a lot of conditions and a lot of regulations regarding this, but it's very Skopje related. From our side as SCOPH, you just apply. So this is the beauty of the public health exchanges. And then we have the IFMSA programs. Basically, IFMSA programs are centralized streams of activities which are organized by IFMSA national member organizations and IFMSA internationally. IFMSA programs address problems within a specific field that we as medical students and global health advocates stand up for, while connecting local, national, and international activities and opportunities that contribute to the final outcome. Basically, I would describe the IFMSA programs as an umbrella. It's a big umbrella that includes all the activities that our national member organizations do. An example, if you are doing a local activity in the UK, it's not even a national activity, it's a very local activity that you organize along with your classmates. It can be enrolled under IFMSA and it would be added to the impact that IFMSA does. And an example, Omnia, when she goes to an external meeting, she will showcase the statistics that we have and the number of activities that we have. So IFMSA programs is the way that can deliver your voice on the local level to the international level. It's not a very hard thing, or it's not a very complicated process. There is a Google form that you need to fill before or after you do the activity, and then there is someone called the program coordinator who will contact you, and they will help you executing your activity, and they can even help you evaluating the activity. And at the end of the day, your activity will be enrolled, and it will be also added to the IFMC activities database, where everyone can access that and everyone can learn more about your activities. It's a very good way to showcase the efforts that you are doing on a local level, and it's also a very good way to increase the credibility of your activity, because you will also get a certificate from IFMSA, and the program coordinator will also help you get some funding, or even some apply to some grants if available. So yeah, again, IFMSA programs is the way to think global and act local. We have a lot of programs, but when it comes to SCOPH, we have five main programs: the health systems program, the environment and health, the mental health, the communicable diseases, and non-communicable disease. So there are five programs. Each one of these programs have several focus areas and several highlights. There are a lot of resources that I'm going to share with you after this session. You will find the focus areas, and you will find the points that you can work on, and the enrollment form as well. So yeah, this is what I was telling you about. And then yeah, I just wanted to highlight the important points. Um, if you're interested in these things that I told you, and if you think that SCOPH is your home, please subscribe to the SCOPH server. I can share with you this link as well. It's basically IFMSA SCOPH subscribe. Send an empty email to this, and then I'll accept you. Or you can also join IFMSA Facebook, IFMSA SCOPH Facebook group. You'll find all the opportunities and all the different things that we do posted there, and also apply for the different opportunities that we offer you. We have general assemblies and regional meetings. This is mainly controlled by your NMO. They accept or they approve your attendance to that, but we'll also share with you any related opportunities. Then we have the different capacity building events that we do, whether it's sessions, workshops, or even online courses. Then we also have a lot of small working groups. Small working groups is basically a group of people who works on a specific topic. In example, we had a small working group working on updating something called the MPO manual. So basically, the small working group collected different resources and created some materials to help MPOs understand their work, and also get some sort of templates, and yeah, some skills as well. So it's not a very hard thing. If you're interested in something, and even if you don't have a lot of experience, if you see a call, do apply. It's totally fine. You might get rejected at first, but then you'll definitely learn from that. You can always ask for feedback, and you can also be lucky, and you can get accepted from the first time. It happens. There is no right and wrong at this, and there is no specific like holistic standard. So yeah, feel free to apply. And then last but not least, I also talked very briefly about the different external meeting and conferences that we have. I guess Omni can tell you more about this, but yeah, whenever you see a call as well, feel free to also apply and get to know more about that specific partner or that specific topic. My last word would be to always remember that there should be a start for everything. So if you're not that experienced, and if you don't know a lot about IFMSA, it's totally fine. You need to try, because if you don't try, you can never learn, and if you don't learn, I don't think you will graduate from school with the maximum benefit that you were supposed to have. So yeah, that's pretty much it. Now the floor is open for any questions, concerns, or worries. If there is something that needs to be explained once again, feel free to let me know. And if you feel that you need more knowledge about a specific point, I can also share with you the resources. So yeah, I guess now I'll stop sharing and so I can see your hands and answer your question. I'm sorry. Okay, I'm sorry. I can't find the bottom. I'm so sorry.
Before you, if you're
Yeah,
ready.
if you have, yeah, that's perfect. I'm so sorry. I suck
Brilliant.
at
Thank
technology.
you for that, Mohamed. If there aren't any questions, yeah, I've just seen Emmett's suggestion. So we'll do a block of questions at the end, and we'll move on to Omnia now. So Omnia El-Omrani is a final year medical student from Egypt who has more than 6 years of experience in global health and student advocacy. She is currently serving as the liaison officer for public health issues for the IFMSA. She is also the organization's focal point to the United Nations Framework Convention for Climate Change and has worked on diverse projects with the WHO, UNEP, and UNICEF. She has co-led the IFMSA's COVID-19 response efforts since March 2020. Over to you, Omnia.
Yes, can you hear me well?
Yeah, we can.
Perfect. So hi everyone, I'm very excited to be with you today. And I'm going to, Mohamed, explain to you what SCOPH has been doing. And now I'm just going to focus on more of what I do. As Will mentioned, I'm the external focal point for all the work that IFMSA does on an external level in the specific committee of SCOPH. And my two main focus areas of work are climate change and also non-communicable diseases, as well as mental health and a few other niche topics. But the main bulk of my work is climate change. And whenever you see me, you'll find me talking about climate change. So I'm really happy I'll get this chance to talk to you about the topic and why is it specifically relevant for us as medical students, but also what is the efforts that we're doing in IFMSA and the efforts that you can do as well in the UK. So I'm gonna share my screen now. Can you see my screen? Okay, perfect. So first of all, why climate change? This is a question I've been asked by so many people, by my friends, my family, anyone in a conference. Whenever we go to the climate change conference, they're like, okay, you're a medical student. Why are you talking about climate change? How is this even relevant? To what you do as a doctor. And I'm here to answer this question because it's really the key to understanding why IFMSA, a global organization that represents more than 1.3 million medical students around the world, is really prioritizing this topic. And why do we want you as well to prioritize it, even though I know that we don't really maybe study it in our own curriculum or hear about it from our colleagues, but it's really important more than ever to think about how climate change is related to health. This is my favorite diagram that clearly explains the health impacts of climate change. Health is both an impact due to climate change, but also an opportunity offered to climate change solutions. But first, we need to understand how climate change affects health. And the most obvious impact, and maybe I can, do a bit of interaction because I feel like we've been talking a lot. If anyone has any idea what are the health impacts of climate change, you can just type it in the chat, and I can see it. Just anything that comes to your mind that you think climate change affects our health in. You can already see the different climate events like severe weather, air pollution, diseases, and so on. But I'm curious to know what are the impacts that you know about. Skin cancer, yes, very interesting and very true as well. What else? Food and water shortages, yes. respiratory issues due to air pollution. We're going to talk a lot about that. So we have, anyone else wants to add anything? Okay, perfect. We're gonna add much more, but thank you for sharing. So first of all, the very obvious link when you think about climate change, everyone thinks about hurricanes and natural disasters and wildfires. So obviously, whenever there's a hurricane or a tornado or a flooding, it leads to traumatic injuries and death. I was just listening on the radio that in Florida there is a storm that is becoming a hurricane, and so far 200 people have died, mainly in Cuba, Central America, and almost reaching to Florida. So this is one of the main impacts of climate change and the extreme weather events that we're seeing, and it's very direct. Also, you can see, especially in Europe, that the temperatures are increasing. And we have very hot summers that you were not normally used to. Even here in the Middle East, we have the weather is really, the temperature is rising, and this has led to a lot of heat stress to the emergency rooms, the departments, and also when the temperature increases, this is something very physiological, but I had to read about it to understand more. But apparently, obviously, when the temperature increases, this really affects the blood vessels, and this would lead to cardiovascular diseases. The next thing, which is Ahmed has mentioned, the food and water supply, because you can see that there are many areas where, for example, there was a certain temperature needed for crops to grow, and now the temperature has changed, so crops are not growing anymore, which means that there's a failure of crops and a failure of the food that used to grow on land, which leads to food insecurity and food supply, and as well as pollution, and this leads to lack of food supply leads to malnutrition. But then when you're thinking about water pollution, this would lead to infectious diseases and waterborne illnesses that would lead to diarrhea, as well as harmful algal blooms, which also affects the micronutrients. Another very important impact, which is not yet studied or proven a lot, and it's more of opinions and cases that are seen, which is mental health. But one very interesting study in Australia showed that the rate of increasing temperature is directly linked to the rate of suicide among farmers, because farmers are losing their land because of the increasing temperature due to climate change, and because that they cannot support their families anymore, they're committing suicide, and this is a proven study. But other than that, there's also the feeling of anxiety that is specifically felt by the younger generations, who you used to see on the streets during the climate strikes, feeling very helpless and not able to change anything. And this leads to anxiety as well as despair, and it's also termed as eco-anxiety. And then finally, as we mentioned before, when there is a extreme weather event like a wildfire or a storm or a hurricane, people can tend to lose their houses, their jobs, but also lose their loved ones, and this leads to post-traumatic stress disorder. And also another thing very important, which is the environmental refugees, and this is as well due to extreme weather events, but also when there is failure of the crops and food insecurities, this leads to civil conflicts, which leads to forced migration, and people are losing the places where they used to live, and they need to migrate to other countries. As we mentioned before, water pollution leads to waterborne diseases like cholera, cryptospirosis, leptospirosis, and very important, as we mentioned, that there is air pollution, but there's also allergies due to air pollution and due to the toxins and the pollutants that are in the air that really lead to a lot of respiratory allergies and diseases. Another very important health impact, which is vector-borne diseases. I know that there are many commentaries and opinion pieces talking about how climate change is kind of linked to COVID. It's not yet proven. However, it is a zoonotic disease, and climate change leads to the increase of zoonotic diseases. And I'm going to show you how. But the final and the most important impact is air pollution. And air pollution leads to the death of 7 million people. So air pollution is a killer, is a silent killer, but it kills more than car crashes do. And I actually read that specifically in the UK, that they did a study and it showed that air pollution in the UK actually kills more than car crashes do. Air pollution leads to a diversity of diseases, and we're going to talk about that in the next slide. Yeah, so these are photos I got from The Guardian actually, and it shows how air pollution in all around the world is increasing, and it leads to 7 million people dying every year. Actually, the WHO also released that 9 in 10 children are breathing air that is polluted around the world, and it leads to cardiovascular diseases, respiratory diseases, ranging from pneumonia up to lung cancer, but also it leads to asthma. And whenever someone asks you about, okay, what are the health impacts of climate change, the most obvious link is either, as I mentioned before, extreme weather events, but it's also air pollution. And this is what WHO has been doing. They were really talking a lot. Whenever you watch any session that WHO facilitates on climate change, they would always talk about air pollution because it's out there. And we can see that climate change has impacted that, and human activity, which led to climate change, is also what is leading to air pollution due to the use of fossil fuels. So that is one thing. I also talked about the other vector-borne diseases. And this specific interesting disease is the dengue virus vector. And as you can see how the capacity of the vector has been increasing over the years. And this is because the temperature is increasing. So the more the temperature increases, the more this specific vector is increasing in its capacity. They're surviving longer, which means that they're transmitting the diseases faster and transmitting that in areas where there wasn't the disease did not exist before. Another interesting thing is that, for example, the melting of the glaciers, specifically in the Arctic regions, has led to the release of the anthrax, which is another vector-borne disease that has been increasing due to the melting of glaciers. But it's not just, as you can see, the health impacts of climate change, like direct and indirect, as you can see in this diagram. So we talked about the direct, which are the extreme weather events that are impacting our health in a very direct way. There are the indirect effects that we talked about, like the vector-borne diseases, waterborne, water quality, as well as food insecurities and air pollution. But what's really important, and we need to always think about it, is the social dynamics, which means that the impacts of climate change are not really equitable or do not affect everyone in the same way. For example, if we're talking about age and gender, women are more vulnerable to the effects of climate change in many regions because, for example, in Africa, women tend to be more exposed to the areas where there are extreme weather events. And at the same time, when we think about age and we think about the elderly, they are really more impacted by air pollution because, for example, they might suffer other comorbidities. And this brings us to the second social dynamic, which is the health status. If a person is asthmatic and lives in a city where there is high air pollution, his health is going to be more likely impacted than the health of a normal person who does not have any chronic disease. And we also need to think about the socioeconomic status because, for example, if there's an extreme weather event that is affecting like a flood and someone who is of a high economic status, they can't afford the damages, they're not going to lose their jobs. But if someone lives in a more vulnerable area or does not have enough income to support themselves and they just lost their job, they're going to be severely impacted. As well as the public health infrastructures, mobility, and conflict status. So it's really important to think about how climate change is not just affecting our health directly and indirectly, but also need to think about the other social dynamics and the health inequalities that are multiplied by climate change. Anyways, I think I talked a lot. And this is also another interesting graph that shows that because of heat, there are more working hours lost. But I would love to jump into what is IFMSA doing on an external level to address climate change. For us to be able to address this topic very competently, we need to start from bottoms up. We need to start from inside out. We need to build the capacity of us as medical students to understand what is climate change and what is our role in the climate crisis. So first of all, this is a very interesting diagram that I really love explaining what we do with. I'm not sure if you're familiar with it or not, but these are the 6 building blocks of a health system. And this was done by the WHO. It explains what are the different components of a healthcare facility or a health system in general. But I just wanted to highlight that we as medical students, we are part of these building blocks. And as the health workforce, we need to address the climate crisis. For us to do that, we need to learn about, and that is why IFMSA collaborated with WHO around 4 years ago, and we created a training manual on climate and health. I will send the presentation after our session, and you can check the training manual. It was super useful. This is how I started learning about climate change and health. And it shows all the basic information you need to know to understand the link between climate change and health, as well as all the different definitions, as well as if you want to do your own workshop on climate change and health, this has very interesting tips and tricks on how to do it. During COVID, we had the time actually to create our own drive folder that has all the different courses, and it was done with the help of our external partners, which I'm going to talk about later. And in this drive folder, you will find a lot of climate and health courses online, some of them either by the Planetary Health Alliance or by Harvard or by the United Nations Framework on Climate Change. It is very interesting, and you can feel free to check it out as well. And we also just a month ago released a new manual this year. It's on how to create an activity on environment, health, and climate change. And you can also find this manual on our IFMSA website. It was designed by our regional assistants in Europe, and it's super useful. It helps you find a way, giving you examples on how to create an awareness activity or an advocacy initiative on climate change, but also who are the type of externals that you can approach and how can you approach them. But also I wanted to highlight that with these different capacity building events, and I know that Mohamed also talked about the different workshops that SCOPH does, and we also did a number of workshops on climate change, and we have seen the best outcome that we have seen out of these workshops is the activities led by members. So as you can see, for example, in the Netherlands, they did a series of conferences. Actually, the conference they had planned was before COVID, but then when COVID happens, they decided to switch it online. But it was very interesting because they had a lot of participants, and it was a webinar series, and they had amazing speakers attended by many medical students. The same in Germany, they did an online initiative called the Planetary Health Academy. They had over 1,000 participants from Germany, and they wanted to really promote the concept of planetary health and climate change. And I had the opportunity to speak in one of them, and it was very inspiring to see so many people online wanting to learn about climate change. But as you can see also, if we go to Colombia, back to Latin America, you can see that medical students were promoting the idea of planting trees and trying to promote not or going against deforestation and so on. And these are examples of active on the ground activities. If we go to the other side of the world, to Australia, this is not on the map, but I'd really love to share it because it was done a month ago. But the Australian Medical Students Association, they did a hackathon where they invited medical students to think about activities and ways to make their healthcare systems and their hospitals carbon free. And we're going to touch upon that as well. So moving on, so we as IFMSA, we did a lot of capacity building activities for our members and for us as well to learn more about climate change and health. But what is the next step? So as much as we're doing a lot of on-the-ground activity, IFMSA is really known for its global impact and as a stakeholder when it comes to capacity, as a stakeholder when it comes to advocating for climate change and climate justice. So it's one of our global priorities, and what I mean by global priorities is that they are key areas that we want to focus on both on an external and internal level. We do want to be part of the climate agenda as a key stakeholder because as youth, this is our future. As medical students, we're the future health workforce who are going to treat the future health impacts of climate change. So our role is really important. And we do that through our policy documents, which are our advocacy tools that are adopted by our medical students every General Assembly. And you can find a diversity of policy documents related to climate change. I really recommend reading them. They are so interesting. You can learn from the call to actions on what are we expecting from different partners or stakeholders, but at the same time, you can read the background and learn more about the topic itself. So we have climate change and health, we have health emergencies, we also have food for health and sustainability, One Health, and finally air pollution. And a fun fact, air pollution was proposed by SFGH UK. They worked on it as well as the health emergencies, as well as food for health and sustainability. So you guys are just big on climate change, I guess. But yeah, and all the PowerPoint will be shared, so you'll find the links to everything. So moving on, one of the main key events of climate change happening in the world is the United Nations Framework on Climate Change, the COP, the Conference of the Parties. So what is the UNFCCC, this huge abbreviation that it took me a year to even say it. So basically, this is the specialized UN agency, the United Nations agency that works on climate change, and they are serving the countries. They are trying to bring the countries together to make them reduce their carbon emissions and work on limiting the temperature rise to 1.5 degrees. What does that mean? So basically, they are not forcing the countries, but they're trying to push the countries to start working on climate change to try to reduce the increasing temperature. Right now, what we're doing, or the activities that are happening around the world, we are heading straight for a 3 degrees increase, and this is catastrophic. And that is why you will find a lot on social media that we need to act now, we need to act urgently to limit the temperature to 1.5. So 1.5 is a very important number that you're going to hear a lot. And who is facilitating this process? It is the UNFCCC. They are also the ones that facilitated the process of the Paris Agreement back in 2015. And every year they gather all the countries to meet in the conference of the parties, because they refer to countries as parties, and that is why this is the conference of the parties. And during every year they bring them together in order to discuss and negotiate and find the best way that all the countries can work together to address climate change. And IFMSA is really lucky that we get the opportunity to send a delegation of medical students to this conference. We've been doing that for over 10 years. We are also a member of the Global Climate and Health Alliance, which is the biggest alliance of organizations that work on climate change and health. They are mainly medical professional organizations, but we are one of the young leaders part of this alliance. We're not just part of it as members, we are also board members. So we are really consulted and we're part of the governance process of this alliance. And we also work directly with the World Health Organization. So together with Global Climate and Health Alliance and the WHO, we work together and we go to the COP, which is the Climate Change Conference, to try to place health at the heart of the climate agenda, because we want to bring in health into the climate negotiations to strengthen the countries, for them to realize that it's not just about the health of the planet or the environment, it's about our own health, the health of their children, the health of their families, and the health of their communities. So we're trying to use the health argument to strengthen the ambition on climate change and climate plans. And then you can see what we are doing, because again, we go there and it lasts for around 2 weeks. I think you all know that the climate change conference this year has unfortunately been cancelled, but next year it's happening in the UK in Glasgow. And this is from the previous climate change conference that took place in Madrid. This is the IFMSA delegation. So what you can see is that when we go there, we are young and we are bold. So we try to either take action by bringing in all these negotiators, all these policymakers to understand that climate change is a health crisis and we need to act fast. We also organize with the Global Climate and Health Alliance their Global Climate and Health Summit. And this summit is organized by GCHA and us as well. And we have a diversity of sessions, just trying to increase the conversation around health and climate change. We also, as you have seen in the previous slides, the policy documents, they are really long. They're like 12 up to 20 pages. So we try to summarize them and create small advocacy briefs that we go to decision makers and use them to talk about climate change and health, food for health and sustainability, because these policy documents are not just on our own behalf as the 10 medical students going to COP, but it's on behalf of the 1.3 million medical students that adopted this policy. We also get the opportunity to deliver statements. This is one of our delegates, Jackie from Australia. She delivered a statement on the role of youth and the link between health and climate change. But that's not the only advocacy initiatives that we do. We also try to be more meaningfully engaged and also produce evidence-based recommendations. That is why we also conduct a diversity of like surveys, and we try to, as well as deliver statements, but also survey the delegates and understand more the situation. Yeah, and then moving on. This is my favorite part, and I think you all know, but it's really inspiring, especially that today there was, as you know, that the climate change conference was cancelled, but they decided to do an online series instead, lasting for 9 days. It's called The Race to Zero. I can send you the link on the chat. But during that, today was the Climate and Health Day, and the UNFCCC, along with the Climate Change Conference presidency of the UK, they were talking a lot about how climate change and health are interlinked. And they highlighted a very important thing that I want to discuss more. But just a quick recap, we talked about our role as medical students as the future health workforce. We talked about governance and how we're doing our advocacy with WHO, Global Climate and Health Alliance, the United Nations Framework for Climate Change. But it's also really important to think about our own workplace, which is our healthcare hospitals and facilities. So, and now more than ever, I think we now recognize how weak our healthcare systems are, especially that COVID has showed that there are many vulnerabilities and fragilities in it, and it's not resilient enough. It was not resilient to COVID, and it will not be resilient to the climate crisis. And that is why we need to invest in healthcare systems. We need to prioritize them, and we need to do it in a green and sustainable way, because healthcare systems have their own carbon footprint. But since we're medical students, we're still not doctors. We try to walk the talk and do this in our own meetings. Mohamed mentioned that we have regional meetings, general assemblies, and so on. And we wanted to make sure that our meetings are environment friendly and sustainable. And that is why we developed a set of recommendations just for everyone, for all our members, as well as for us, to make sure that our meetings are environment friendly. It talks about everything about the venue, the use of utensils, up to the carbon offset of flights and everything. So feel free to read it as well. I promise you it's very interesting and not super long. But this is what I wanted to really highlight, is that today during the Race to Zero dialogue, and I think since the beginning of 1st of October, the NHS has announced that it is the first healthcare system in the world to commit to net zero carbon by 2040. What's even more interesting that I learned today is that they are actually planning to reduce by 80% their carbon footprint by 2028. So they want to do that in 8 years, and they want to go green and reduce 80% of their carbon emissions, which is really inspiring to see that finally a healthcare system nationwide is committing to sustainability. And it was also it's also a perfect timing for the climate change conference that was supposedly happening today as we speak, but it's happening next year. But I remember also during the climate change conference in Madrid, the mayor of Glasgow was talking a lot about how the city was really transforming by investing in sustainable transport and infrastructure and so on. But it's really important to highlight how health systems are also part of the emissions. I learned today that the NHS represents 4.5% from the carbon emissions of the country, and by mitigating that, it's going to do a huge reduction in the carbon emissions. So it's important to see a healthcare system taking the lead on that, and it would be very inspiring to see healthcare systems around the world doing the same. And then, fun fact, they also created the first electrical ambulance, like net zero carbon, in the UK. So it was very interesting to see that as well. So the final thing, I hope you're not too bored of me, and I think this is the last building block I'm going to highlight, and my absolute favorite. So we talked about the health workforce, we talked about advocacy, we talked about the healthcare system, but we need to talk about something that is super important, which is education. So I personally learned about climate change because of IFMSA. If it wasn't for IFMSA, I would never heard about it. And this is the same case for all my colleagues. And this is why it's important for us to take a look at our own education and ask ourselves, why aren't we talking about climate change? Why isn't it in our curriculum? Why don't we have any mention of it? Maybe in many countries do. I'm not sure whether in the UK or in other countries in the world, they have a mention of it or not. But I'm not sure that I don't think so. I don't think that they have that much of emphasis on the climate change impacts. So we back in 2018, 2 years ago, we worked with the Global Climate and Health Alliance and the previous LPH, decided that we wanted to create a vision for IFMSA to integrate climate change and health in the medical curriculum. They called it the 2020 vision, but they did not know that there will be COVID in 2020. But the intention was good because they really wanted to see an element of climate change and health integrated in every medical curriculum by 2020. But that did not stop us. Maybe you don't see climate change in every medical curriculum, but it really motivated us to start thinking about, okay, is climate change really not mentioned in the curriculum, or do some countries mention it, and how do they mention it? Is it consistent or is it not? What can we do about it? So we launched a global survey that started in March 2019 up to March 2020. So it took us around a year. We asked all the NMOs, the member organizations in IFMSA, 3 questions. First of all, how many medical schools do you have in your country? Does any medical school and how many mention climate change? And are any of these medical schools have students who do activities on climate change? Because we also wanted to see whether students really care about climate change and they're doing activities on it or not. So we discovered that only 15% of the medical schools that we searched had a mention of climate change. So we did that in 112 countries, participated in this survey, and they mapped 2,870 medical schools, and only 15% of them had a mention of climate change. And surprisingly, even a less percentage had students who conducted activities related to climate change. So this percentage is really concerning, but it's also a strong advocacy tool for us to call on our faculty members, our universities to change that, because it shows that healthcare professionals, the future health workforce, is not really prepared to handle the climate health impacts. And we saw now with COVID, and we saw how it was very there was a lot of urgent action taken, but COVID did not stop the climate crisis. And we need to have a resilient health system with an informed health workforce, which is basically us. So this brings me to my final 2 slides. And as I said, like with COVID, it really showed that urgent action is possible. We've been seeing that all around the world. Governments, world leaders acting, taking urgent action to stop the pandemic. People are also taking so many precautions to protect themselves and their loved ones. But at the same time, they were doing that because of health crisis, which is COVID. Climate change is the biggest global health threat of the 21st century. So we need the same urgency when it comes to the climate crisis as well. And that is why we, as IFMSA, we joined the Health Week Recovery Open Letter. So we recognize that we are now, amidst the pandemic, but at the same time, countries are shaping their post-pandemic recovery plans. And we need to make sure that we're not doing the same mistake again, and we're recovering in a way that harms our environment as well. So that is why we drafted an open letter that was signed by over 40 million healthcare professionals and 350 organizations, including us and many of our NMOs. In this letter, we called on world leaders to invest in a healthy and a sustainable post-pandemic recovery plans, to make sure that the plans to stimulate the economy back again are sustainable, are investing in renewable energy, are net zero, so that we are protecting our health, but also the health of the ecosystem that is sustaining us. And then finally, I really love this because it shows that with COVID, we are calling on flattening the curve. We also need to do the same with the climate change and planetary health. We need to put sustainability as a priority because it's more important than ever. And as the healthcare community, we have a strong role to play in that because simply it's in our commitments to do no harm. And we need to not just protect and treat patients, but also protect their health and the health of the environment on which it depends. So thank you so much. I hope I did not speak for like 10 hours or something. And I would love to hear any questions that you have, anything that comes to your mind. And again, I will share with you the presentation so that you can click on all the resources that I added.
Brilliant. Thank you, Omnia. We'll just leave it a few minutes to see if anyone has any questions. And then if we can keep everyone for just 5 more minutes, I know Amit just wants to say a few final words. Okay, well, thank you very much, Omnia and Mohamed. That was really interesting. So I want to say thank you on behalf of everyone. Amit, do you want to take over?
Yeah, thank you. Yeah, firstly, thank you very much to Omnia and Mohamed. It was amazing hearing you both speak. And I do have a question for you both, but I'll put that on afterwards at the very end. Do you mind if I just quickly try to share my screen? Let's see if it will let me do that. Can you see my screen here?
Yeah, we can. Oh, it's loading now. Yeah.
Great. So I just want to quickly go over what our plans for climate and health are, because they've obviously Omnia's very much highlighted the importance of taking this into account as medical students, and even more so talked about the COP25 events that happened in the past, and the COP events in general as well. And so I thought it'd be good to like share what SFGH are doing on our end in regards to public health, in regards to climate and health in particular. So as part of the coordinated theme, we've chosen climate and health, which was voted in by the whole network to be pushed forward. And under that, we also opened a national working group on COP26. That's just an example of when we had actually opened it. And I'll talk a little bit about what our plans are throughout the year, so you guys can keep an eye out and hopefully engage with us and get involved, because I'm sure Omnia and Mohamed have inspired you the same way as they've inspired me to get involved with this kind of thing. So the first phase of our year-long campaign up until COP26 actually happens, which is in November 2021. It's about a year to go, a year and a month or so. Is to increase awareness. That's the first thing that we're doing up until about February. We're working on discussing COP26 and what it actually means, going into a bit more detail about climate governance, kind of another example that was given by Omnia earlier about how the different processes around climate governance actually occur. Talking about climate justice, for example, and talking about refugee health as a part of climate justice, for example, as was shown in Omnia's reel that she showed as well. And then as a second part of our advocacy for climate and health, we'll be running big campaigns throughout the country in preparation for COP26, pushing different stakeholders across the country, whether it's parliamentarians or working in liaison with different stakeholders such as different NGOs. AFGH is one of the ones that we're working with a lot at the minute as well. We'll be pushing our aims through that platform, through awareness raising and just really pushing as hard as we can. And hopefully with COVID decreasing in the future, fingers crossed, we'll be able to like even push these demands even further and further through parliamentary engagement in person. But even if it's not in person, we will be using different techniques to lobby and engage with the parliament in general. What I'll do is I'll put a link to the coordinated theme Instagram and Facebook page in the chat below after I stop sharing this. And it'd be great if you guys could just give it a follow, check it out, keep an eye out there, because any opportunities that come up or any way in which you can support us in sharing content or attending webinars, etc. It'd be great to see you all there. In fact, I think Omnia is going to be joining us in not too long, in a few days actually, to talk about COP26 in a bit more detail and her own experiences with COP26. So that's something to look forward to straight away. But yeah, thank you very much. I'm just going to stop screen sharing now. I'll quickly chuck in the questions in a minute. So it's the link to the website in a minute. A quick question to Omnia and to Mohamed. I've known you guys for a while now, but I don't know how you guys got involved with SCOPH. So I'd be curious to hear what got you guys involved with public health, and what brought you to where you are today.
Yeah, that's a very interesting question, and it makes me feel very old right now. But I think I first got I was really lucky to get introduced to SCOPH when I attended my first General Assembly in Macedonia back in 2016. Um, so this was my first ever IFMSA event, and by chance the president of our NMO put me in SCOPH because there wasn't anyone going to SCOPH, but automatically I really loved the diversity of the topics. I think in SCOPH it's not just climate change or NCDs or mental health, but it never ends, and I think it cross cuts everything, and and what I loved most is that being in my first General Assembly in the SCOPH sessions, everyone comes from countries from all over the world, but we all had the same passion, we all had the same thoughts, we all wanted to do the same thing. Especially with SCOPH, whatever the topic is, you have certain tools that you can either build the capacity of members, or you can do an awareness campaign, or you can just raise awareness about an important topic that you care about, an important public health issue. And it's for me, it's not just public health, it is global health. And I remember the first in the introductory session, the SCOPH back then just had this huge slide that said like, think global, act local. And I was like, yeah, that's really cool. But I think it took me a while, like years, to understand what that means. Is that, when you travel and when you go to meetings in IFMSA or external meetings, you see all these global challenges, and then you look back at your own country and you feel like, yes, we do have that, but it's good to even raise awareness about that and try to relate to that and use what you learn from others and do it. And I think SCOPH really provides this opportunity because of the diversity of topics, as well as how established IFMSA is as an organization and our members, how active they are. So I hope this answers your question.
Yeah, and from my point, I would say that I started from the bottom because I was just a very, very random medical student, and I was very curious to know what um what is my LC doing. So yeah, I just registered for one of the activities, and then I met the local officer at that time, and then I became the local officer. So yeah, it was very random at the start, but then I started to realize um what I'm doing, because yeah, I just want to press that it was very, 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 very random. And I remember that at some point I was just talking to my friends and I was telling them that, oh, there is something called IFMSA and they do 1, 2, 3, and we were even talking about the TO and that regular medical students can be TO members. Yeah, and here I am. So yeah, it brings me a lot of memories in 4 years ago, and it happened very fast. So yeah, that was the very first thing that I did. I just asked, and yeah, I don't know if there is something else I can add, but I can't really remember. I'm so sorry.
Yeah, those answer my questions wonderfully. Thank you so much. And thank you so much for talking today. Like I said, it was great to hear you both.
Great, yeah. If there aren't any other questions, then we're done for the fourth webinar of the series. So yeah, again, thank you for coming today, guys, and thank you for giving up your time.
Thank you for having us, and have a good night.